Well, I'm Bob Lujano, and in August of 2017 I had a heart attack. And since that time I've had issues with sleeping. So I signed up for a sleep study to determine if I have a sleep apnea issue. Hopefully this sleep study can do something that would help me in wanting to live a more healthy, active life. Whenever you do have sleep issues, it could be a result of secondary health conditions or a type of sleep apnea. Oh, this looks like the honeymoon suite.
It's the biggest room.
Since my heart attack in 2017, my snoring has been getting louder and louder. There's even periods where I will not breathe for about a minute. This might be the earliest I've ever gone to bed. Well, being a person with a disability, you're more susceptible to secondary health conditions. So in regards to sleep apnea, I'm thinking a lot of people don't know that they have it, or kind of maybe just blow it off as, oh, I'm working too much, or this is how I've always slept, so it's okay. But you definitely need to be aware that your sleep pattern has changed and why, and talk to your physician about it.
Well, sleep apnea can be really mild to really severe. It all depends, and it affects people differently. If you have really severe sleep apnea, that's when you're really tired all the time. It can cause heart attacks, weight gain. There's a whole list of symptoms that it can cause. When you have it that much, like you're asleep, but your body's not actually getting any rest. There's an obstruction up here. You're usually still trying to breathe down here, but nothing can get in or out up here. So your body's trying to fight to get air. And so once you put the CPAP on, it opens everything up and you can breathe a whole lot better.
How did it feel getting hooked up?
Oh, it was fine. It was, yeah, I mean, I can't see what's happening, so I see a mirror over there. I could probably look at myself and, oh my gosh, yeah. I'm gonna get up early. I probably am gonna go to sleep soon.
The doctor will be in to give you your results at 7.
Okay.
So you'll know everything in the morning.
It's basically a week, almost a week since I last had the sleep study. I'm very happy with the results. It's great to know I have sleep apnea, which is what I wanted to find out. Now we're taking the steps to help remedy the situation. And I've been using the CPAP machine for about a good 4 or 5 days now. And it's been kind of a different experience of sleeping. However, I will say that sleep has been just outstanding. You know, I wish I would have had the study about 5 or 6 years ago. Not that it would have prevented me from having a heart attack, but maybe there would have been some early indicators. You know, in the meantime, having the CPAP and feeling more energetic and more refreshed, to me it seems like I'm already ahead of the game in regards to addressing health right now. So, you know, at the end of the day, I'm very thankful for the sleep apnea test. You know, sleep is important for everyone. You want to be at your best, and whether you're working or involved in sport, involved in a family, you know, at the end of the day, if you do have sleep apnea, it's important that it gets addressed, and maybe there's a reason why you don't feel as energetic. This may be one of the reasons.